So for today, we are going to look at case 1 and case 3. I will start with case 3 for those who were here yesterday and are repeating the session today. And then we'll go back to case 1. So case 3 is about a child named Grace. She is 11 years old, and she was brought into the A&E room because she has been raped by her neighbor's son. She has been abused physically by her parents because of her perceived disobedience, and she admits to the nurse that she has been sexually active since she was 9 years old. So the routine blood screenings we are going to do will reveal that Grace is positive or reactive to a syphilis screening, and she also has genital warts and is HIV positive. So we are going to move to the system, and then I will demonstrate how we can collect record for a case like this. Now, I know in country that there are different procedures to a case involving a minor, but we are going to skip all of that procedure, and we're just going to focus on what it is that the clinic will do regarding data entry into the system. So I will log into patient management and reporting system. And on the home page, if you already have an account, you will see that if you are a pharmacist, you will get this blue container here where you can change your pharmacy if you are dispensing drugs from a different pharmacy. But if you're not a pharmacist, all you will see is just the page looking like this with this welcome screen. On the left of the page, we have the pages menu. When you collapse this menu, you will get general population, counseling, and testing. If you expand this sub-menu, you click on create new client account. Now, we are assuming that this is the first time Grace is coming to the A&E and she has no account on the system. So we are going to create the account. Now, today is the first day of February 2022. The contact of reporter, which is going to be my contact, just in case the supervisor reviews the data entry and wants to reach me. I can put in an email address, I can put in a work phone number, whatever is best for you. The facility type, and this is, let's say, a private health clinic. And then the first name of the child is Grace. We don't have a middle name, and we are going to make up a last name for Grace. So I'll say her name is Grace Green. And she was born, she's 11 years old, which makes her born in 2011. So let's say she was born on 1st of February. Today is her birthday, 2011. She is a female, so we are entering the biological sex of the client. So any client you have, whether adult or child, this sex here means the biological sex and not the gender identity. The mother's maiden name is, so her mom is there, so we can ask the mom what her name was if she's married before she got married. And so let's assume that the mother's maiden name is, so I'll give the mother's maiden name Jeffrey. The testing code is generated automatically. And because testing codes are not unique, we will not use the testing code as her unique ID on the system. So I will give her or create a new ID for Grace. I will assume that she has an international passport. And on her international passport, her ID is A11032. And this is going to be international passport. So when you collect information for a client, you fill in the information on the form based on what is allowed or the type of information that you are allowed to collect in your country. For every field where you are not allowed to collect the information, or the information is not known, or the client doesn't want to reveal the information, just fill in unknown on those fields. What is very important here is the year of birth. You always want to get the year. If the client cannot tell you the exact year, you can make an approximation of what the year you think is, but you want to always enter a year of birth. The system will accept no year, but for reporting purpose, you need to enter a year so that later on, if the client ends up being positive, and down along the line, when the client gains trust, the client might want to tell you their year of birth, and you can enter that here. But for every other information, you can use unknown if you are not allowed to collect the names of clients. Or you just collect the first letter of their names without entering the full name. And then once I create this account, the system is going to generate a whole file for Grace. For me to get access to that file, I will need to go back to the Pages menu, go back to the General Population Counseling and Testing submenu, and click on Request Release of Client File submenu of the General Population Counseling and Testing submenu. You put in the current date or the date you want to access the system, and it has to be the current date. And then the unique ID for the client whose record you want the system to release. The type of screenings you are going to do for the client. So we are going to screen her for HIV. We are going to be doing a tuberculosis screening, and we are going to be doing a screening for syphilis. And then I will save this. Once you save this form, the file of the client will be released for you to update, enter information, view until 11:59 p.m. of the current date. Once it is 11:59 p.m., regardless of the time you release the record. So if you release the record at 11:58, at 11:59, all access to the records on the system will be withdrawn, and you will have to request access again for you to get access to the client's file. Now we want to collect information. So the next thing you do after you create the account, you request release of the client's file. You click on Collect Client's Information. You enter the unique ID, and then you get to the screen where you get access to the client's file. On the form, above it is a container that tells you the unique ID of the client whose record you have opened. If this is not the correct client you want to see, you have to go back to Collect Client Information and enter the correct unique ID so that you don't update the records of a wrong client. If the client is a female, so if the biological sex of the client is a female or intersex, the system automatically starts flagging pregnancy information. It will give you summaries for the clients. It will give you the basic summary that involves the age of the client, the sexual orientation of the client, the biological sex of the client, the gender identity, the sexual partners, number of sexual partners, and the test status of the sexual partners. It will also give you behavioral summary once you fill in the risk behavior of the clients. And then it gives you additional information beneath the behavioral summary if the client has had any pregnancy recorded on the system, and if the client is positive or referred or is in care. So we are going to see how the system generates and fills up this information as we fill in data for this client. The personal information form is the first form you find on the first tab. You will notice that there are several tabs, and for every female client, you'll find a pregnancy history, new pregnancy registration, antenatal or maternity follow-up. The last three tabs is only available on the file of a female client. For a male client or a client whose biological sex is male, the whole tabs end at vaccination history. So you'll find a difference in the forms you will see based on the sex of the client. Now we have the personal information as the first form. You collect as much information as is allowed or as you have. Now you note that you don't force a client to give you information. they are free to skip information that they don't want to give, and you fill in unknown for information that you do not have. If the information is not applicable to the client, you skip that question and fill in not applicable. Now, the date of this report is today, which is 1st of February, 2022. The first name and the last name we collected when we created the account is populated automatically. She has no middle name. Her mother's maiden name is there, her testing code, unique ID, and the type of ID. Now, this whole information at the top here are information you cannot change once you enter them. Only your supervisor will have the permissions to change these names and testing codes and unique ID. So if you have any need to want to change this in the future, or there's an error, or you need to take out the names, you have to call your supervisor to do that. We have the ID type 1, ID type 2, ID type 3. So in the situation where you have like a hospital registration number, you have a national identity number, and maybe you in the country, the hospitals use hospital registration number, and you want to have that number on the system so that in the situation where a client is using a different type of ID, or an ID is made up, or they misplace that ID, you can look through the list of registered ID of the client to update the unique ID for accessing records to one of their IDs that you have recorded. This ID type 1, type 2, type 3 is an optional field. You can skip them if you don't have the record, but it's easier security-wise to be able to enter multiple IDs so that when the clients cannot remember their ID for you to retrieve their record, you can have an alternative to search the true identity of the client so that you don't access a file that does not belong to them. So the date of birth is automatically stamped on the page also. Date of birth is something that only your supervisor can change once you enter it. So if you make a mistake, only the supervisor, because there are information in this life that can never change. A date of birth of a person can never change. It's not possible. So once it is entered wrongly, the person who entered it wrongly will have to call the supervisor to prove that it was wrong and not that you're changing it for malicious or different purpose. Now, the country of birth of Grace is not given, but I'm going to alter the story. In real life, you are going to put unknown in situation where you don't have the information. But for this practice, I'm going to put in any information. So I'll say Grace was born in the Bahamas and Grace lives in, say she lives in Dominica now. Her address in the country of residence. So let's say Grace lives at Wall House and she's in Libya. Health district is Roseau Health District. Do we have that? Yes. And then the parish is, let's say, St. George. The length of time in this country of screening. So we'll say she came here when she was 2 years old. So she has spent 9 years here. She's female. Her gender identity is female. Her sexual orientation is heterosexual. The telephone number. So this is an optional field. If you want to have the phone number of a caregiver or her mom in this case, you can put it here, but it is not a required field because it's a field that it's at the discretion of the clients to decide if they want to give out those kind of information. Grace is 11 years old and she is single. Her ethnicity is not known, but I will assume that she is, let's say she is, there's no Caribbean. Okay, I'll say she's mixed according to the story. And then her occupation is student or not applicable, but at 11, she'll be going to school, so we'll say student. Her highest level of education, she's still in primary school. Her number of sexual partners. So now this is the question where we are very sure that according to Grace's story and her mom sitting down there, she will not tell us the real thing. But she was raped, 1. She said she has been sexually active since she was 9. We will assume that the minimum number of sexual partner Grace has is 2. So we'll assume it's 2 to 4. Or you put unknown if you don't want to fill anything. But we know that she has sexual partners, but we don't know the number. But we know that she doesn't have less than 1. She has 2 and above, but we don't know how much. Her type of sexual activity, she has had vaginal sex, which is sure, but we don't know about. Any question? Oh, okay. Okay. So we're sure she's had vaginal sex, but we don't know if she has had oral or anal sex. And so we'll put only what we know. So we have, is she currently pregnant? And we don't know, so we'll put unknown for now. Has the client's regular sexual partner been tested for HIV? We don't know. Is the client alive or dead? She's sitting down there, she's alive, and cause of death is not applicable. Has she left the country? Yes, she came in when she was 2, so she has lived somewhere else. And so we click on save. So the information is now saved. And as soon as you save the personal information, you will see that the basic summary on her page is updated to fill in key information that you can use to decide if this client is a candidate for a risk reduction plan. So we'll deal with risk reduction in the coming weeks, but the purpose of these summaries here is to flag summaries and behaviors that will tell you in one glance what you want to do next with the client. So the risk behaviors is a compulsory form that you must fill for every client at every visit. Personal information is a one-time thing. You can update if information changes in many years to come, or anytime the client visits, you can review to see if there's an update to the last information you have, especially when it has to do with number of sexual partners. If the client is on risk reduction plan, and the clients might have 5 to 9, you gave the advice, they have reduced from 5 to 9 to 2 to 4. You want to update that number of sexual partners. The type of sexual activity changes. Maybe they have stopped having vaginal sex and it's just anal. You want to update that also. So we have risk behaviors. For the risk behaviors, every field is compulsory because the majority of the reporting indicators revolve around the risks. If you collect information for clients and you don't collect their risk behaviors, you'll be missing a lot of reports because there's no how the system will calculate these figures without having the risk behaviors of the clients entered. The date of report is 1st day of February 2022. Grace has had sex with males in the last 12 months. Had sex with females, we do not know. Has she had sex with persons of known HIV positive status? She'll say never. Has she had sex with sex workers? Let's say it's not applicable because she's a child. So some of these questions, you decide according to your VCT training if you want to ask a child these questions or you just want to skip to just finding out about blood transfusion or victim of sexual assault, or if the child has perinatal exposure to HIV. The majority of them might be not applicable. For her age, we don't want to assume because of what she admitted to that she's not taking drugs or anything. So we'll ask her if she exchanged drugs for money or material gain, or exchange sex for money or drugs or material gain. And she will say never, which will most likely be a lie because her mom is there. And then we are going to ask if she has ever shared needles while injecting non-prescription drugs. She'll say never. Crack cocaine, we'll say never. And then if she has had sex under the influence of drugs or alcohol, we'll imagine that this is not applicable. We will ask because of her lifestyle, and she will tell us never. Had sex with multiple partners. We know that the answer is in the last 12 months. Had perinatal exposure to HIV. The mother said she's negative, and so we say no. So received transfusions of blood and blood products of clotting factors. Let's assume that the mother said when she was 3 years old, she had a blood transfusion, and so we'll say over 12 months ago. She had occupational exposure. No, it's not applicable because she's not working yet. Has she been a victim of sexual assault? Yes, that is why she's here in the last 12 months. So has she received a transplant of tissue or organ or artificial insemination? We will say this is never. Confirmed diagnosis of STI at the time of HIV testing. We don't know yet. So this is no diagnosis is confirmed, but we know that she has something. Confirmed diagnosis of TB at the time of HIV testing, no. Had contact with confirmed TB, they'll say unknown. previously diagnosed with HIV, and this question is for TB patients, and so this is not applicable. Her condom use. So we'll ask her if she knows what a condom looks like, if she has used a condom before, if she was raped with a condom, and we might decide that this is not applicable because we might not want to ask, or we might ask and she might not want to tell us because her mom is there. So is the client incarcerated or have history of incarceration? No, she has never been arrested because of her age. She has never been homeless. She is not a sex worker. And she has not had sex with transgender female before. And so we'll click on save. And these are all the risk information we need to collect for a client. As soon as you save the risk behaviors, you will see that the behavioral summary is automatically updated with important behaviors. Has the client had sex with, if the client has had sex in the past 12 months, everything that's happened in the last 12 months is going to be in red text. Everything that is over 12 months ago, apart from things like blood transfusions and organ transplants, is going to be in black. So things that have a higher risk of, or is a higher risk of getting infection, even if it's over 12 months ago, is going to be in red. Everything in the last 12 months will be in red, and everything that is a risk but does not apply if it's over 12 months ago is going to be in black. Now we have the comorbidities and other information. So if you want to see if there are comorbid information of a client, which is an optional form, except the client tests positive to any condition or the client is going to be on pre or post exposure prophylaxis, you don't really need to fill this form if you are conscious of time. But if you have enough time on your hands, you fill the information, you put in the date of the report, if the client is diabetic, so we'll say no, she has no lymphoma, she has no renal disease, she has no lung disease, she has no high blood pressure, but the mother will tell us that she's HBSS and so she has sickle cell. The alcoholism is no. Malnutrition, let's say no. Reason for test is possible exposure because she came in because she was raped, right? So possible exposure and thought to be at risk. Has the client been previously tested for HIV? Let's say no to all questions. This is the first time she's at the STI clinic. And then we are going to save this form. Once you save, now note that on every form, on every tab, there is a save button. You have to save every information before you move to the next tab. So I will pause for questions before we start the screenings. Okay, so for the color code, any important information that the system flags that you need to make a decision, especially for risk reduction or to put the client on pre or post exposure prophylaxis, or to find out if the client is positive or in care, those kind of information will be in red text. If the information is a risk behavior that happened in the last 12 months, it is going to be in red text. If it happened over 12 months ago, it is going to be in red text if the time it happened does not reduce the risks. If it's happened over 12 months ago, and if the time is important or the time decides how risky it is going to be in black. So anything in red is a more serious flag, and anything in black is for you to make a decision by yourself. Janelle, does that answer your question? Okay. All right, so we are going to look at the HIV screenings. Now, in last week's training, we discussed the test modalities, and those are for the supervisors and program managers to decide what naming they want to use for their test modalities. If you want to go ahead to use the namings that UNH need for the report, you want to look at the manual and see the modalities. I have listed a few of them that I feel that you are going to use most of the time in the countries, and the definition if you can't go through the whole manual. The HCS index is a test modality that is an index text, or is it's like the modality used to test an index client or a partner, either a injection drug partner or a sexual partner or siblings of a positive child, or the mother of a positive child or the father of a positive child. The HTS-TST is an indicator for almost all other testing indicators apart from anything that has to do with antenatal. And so, but the HTS-TST is grouped in different categories. They want to also know how many testing was done in a mobile facility. If you did it in an outreach, in a school, in the marketplace, you set up a camp where you do testing is on the mobile. If you, in a facility, is in a healthcare facility that has a unit dedicated for STI, so it's a facility. If it is self-test, it is going to be the number of test kits that you distributed, but not the number of self-tests that was done. If it is recent, it means it is a confirmatory test for a positive rapid test. And if it is RTRI, it is the rapid test for recent infection. So we populated different namings during the trainings of last week. These namings are not the standard one, but the countries will decide what you want to name, and you, during your system configuration, you name your modalities the way you feel it's more understandable, or you have an agreement in country on what will mean what you report on, but you have the names. So the date of report is 1st of February 2022. We are going to be testing, let's say she's in an emergency unit, and this is a patient-initiated testing and counseling, because you, as a healthcare provider, is telling the mom you are going to test for a particular, all of this disease because of her symptoms for syphilis, and she was raped. And so I would say this is provider-initiated. It might not just be provider-initiated, but for this demonstration, I would say provider-initiated testing and counseling, and it is in an emergency room. The type of tests, we are going to start with the rapid test. Now, let's say we are going to use determine, and we are doing a serial test. So we'll do determine first, and determine is reactive. And I want to decide that I am not entering this record until I'm done and I've seen the test results. And so because I see that determine is reactive, I'm going to do the Unicode, right? And I'm going to have the result as reactive also. Now I'm going to conclude this, and I will put the date of the results, which is 1st day of February 2022. Now, if you are doing just one test, the determine, you fill in determine, and if it's not reactive, you save, and you don't need to enter the other values for the test too. If you are doing both, you might want to save time by waiting to enter both of them at the same time, in case if the first one is reactive and you want to use the second one to find out if it's reactive. And then when we save this, we want to do, we're in the hospital, so we can take the blood for a confirmatory test. And so we are going to do a confirmatory test now because she is reactive. And I will put in the date. And the test modality is recent, which is for confirmatory test. And the type of test is, we'll do an ELISA-based test. And we are not using a test kit. The result is positive. And the date is today. So in real life, you might not be getting the result the same day. So you put awaiting results, and you put the date you are awaiting the result. And when the result returns, you fill in the form again, this time, putting the results of the test. And so we have it on the form. Now you'll notice that on the right side of the form, you have so you notice that on the right side of the form, you have the history of the screenings that was entered into, that the client ever had. So if this is like a year after, you will always have the screening history on the form. And so that this will guide you to know if the client has been tested before and what the result was. Now this client is positive. We want to screen for syphilis first before we go to tuberculosis. The date of report is 1st day of February 2022. We are using, let's say we'll do a VDRL test, and she has a titer of 116, right? Or let's say 64. And we'll say this is reactive, and the date is 1st of February. But since if you do a rapid test, you won't get the titer values, right? And I want to find out, in countries, when you do the rapid test, do you go straight? If the rapid is reactive, do you do a VDRL first before you do the TPHA, or you just go straight to doing the TPHA? Anybody with syphilis testing in country?
St. Vincent here for me, Glover.
Okay.
When we do the rapid test and the rapid test shows up positive, I send them for the VDRL and TPHA one time. Okay. I do both.
All right. So we are going to record the VDRL first, and then it has a titer value. And then we are going to record results for the TPHA. So this is 1st of February. So I'm doing this and getting the result the same day because we are using a hypothetical scenario. But you know that in real life, most of the time you are putting awaiting results. And when you get the results, you come back to the client's page and then you update the results or you enter the results. But when you are sending out this request on the form, you might want to try to put in the unique ID on the form so that when the result returns, you can go to collect information or go to update, enter the unique ID, and then you update the client's result. And I'll show you how to do that in a while. So we are doing the TPPA, TPHA in some countries, FTA in other countries, whatever test you use to confirm syphilis. It's going to be the drop-down menu for the type of test is going to be populated by the supervisors or the program managers or the IT based on the list of the tests they get from the lab. So you will have the drop-down menu populated with the list of what you do in your country. So this is also reactive, and it is 1st of February 2022. And so we save this. Now, Grace is an index. Her mom needs to be screened as for partner notification service. Her siblings, if she has younger ones, needs to be screened. So they are all contacts. So you want to ask the mom if she's bringing in the other children, if she has, or you want to ask the mom if she needs to be tested there because she's the mother of an index child who is positive. In the event where the mother is not available and she came in with the dad, you will ask the dad to bring the mom to be tested. If the mom is positive, you test the dad. If the mom is not available, you test the dad. But I think the pattern is for a positive child, the mother is the first contact and the other siblings. And if only when the mom is not available that it becomes compulsory that the father is screened. So the Grace will need to be referred for care and management. And then we need to do other screenings. Now, you can leave the other screenings to the clinical care coordinator to go further, but at the emergency center or at the health center level, you are dealing with HIV syphilis. You might want to do a TB test just in case it is a regulation to screen for TB. And then you will go 1st of February 2022. If you are doing a TST or you want to do the expert test once and for all, you can do that. If you are doing the skin test, you are going to fill this in, you are waiting results. Then when the client comes back in the next 3 days, you fill in the duration of the test. But we are going to go further and assume we are doing an expert MTB RIF, and we are going to have her MTB detected and RIF resistant. So the test result date is this. So we have a client who is resistant to the treatment, and she has TB, and she has HIV, and she has syphilis. And I don't know if you do a drug resistance test for HIV right away before placing into care, or she'll do it at the care. But at the level at which she's referred into care, you can request for a drug resistance test for HIV before she's placed on earth, or depends on the decision of the clinical care team. So now Grace has HIV, Grace has TB, Grace has syphilis. We want to list her contacts. The mom is not psychologically ready to be screened. The mom said she will come back. We want to leave that as a contact for when the mom comes back. So in case if she doesn't come back, the contact tracing team can keep following up until the family or the people who need to be screened as contacts of Grace are contacted. The neighbor's son who raped her also will need to be informed that he needs to be tested. And so we're going to put in the information that they have given us. So let's say the neighbor's son's name is Brown, and the last name of Brown is Grass. The contact address is the same address where Grace lives, and Grace gives us her address. So we'll put it as 25. So she lives at, let's say she lives at Wall House. She gave us a contact number. She has the number. So the number is, and the sex of the neighbor's son is male. And so we save this. So you want to either use the method of contact tracing if you want to inform, if they want the care provider to inform the contact, if they're going to inform him themselves. But the mother right now doesn't want to have anything to do with the neighbors. And so she submitted the names so that the contact tracing team will contact them for tracing. And then apart from the tracing, if the neighbor's son is not a minor, then you might have social services dealing with another issue with the same person. So for now, we are going to deal with the part of the health care of the person who raped her. Now, she said she's also sexually active, and her teacher is one of her sexual partners. So she gives us his name also. And so let's say the teacher's name is, I want to give a name that is not on this training. I don't use people's name. A name, I'll say the name is, let's say, Gab, like this. And then the last name of the teacher is Professor. Just give name. And then the address of the teacher, she gives us a school address. Let's say she schools at, the name of her school is Success Academy. And she gives the number of the principal. And so we can call admin to request to speak to this teacher. And so the number is 6666666. And the sex is male. So we have two arrest cases on our hands and two test cases on our hand. Her teacher, the person who raped her, the contact of the teachers, and the contact of the people who, of the person who raped her if they turn out positive. So for now, we have these two contacts. The mother has said she's going to come in with other siblings for screening, but she needs time to digest the information. And so we'll put it in the extra notes that the mother has said she's going to come back, or she'll go to a health center now, not the hospital, and get tested herself and the children. And so we'll say, mother agreed to get screened along with her two other children at her closest health center. So you leave a note so that if they come the next time to the clinic, they are referred for care and management. The clinical care team, the clinical care nurse, or whoever is in charge will see the notes and follow up and find out if the mother has been screened and if the siblings have been screened. If you have any screening results that you want to upload, hold on. So sorry, if you have any screening results that you need to upload, if it's like a report, like an x-ray, like you have a drug resistance test reports coming in from overseas, or you do it in the country, you want to upload that here. And this is just a placeholder pending if the countries or when the countries decide to integrate all the systems, and then you won't need to upload, you always find your results from the other lab information systems. You want to ask the mom to give you the vaccination card of Grace to see her vaccine history, and then you want to fill in all the vaccines that Grace had collected in the past. So we'd say at birth, I want to put this in here. I'm filling this record today. At birth, she was given a Hep B vaccine, and she was given the first dose when she was born, and that was on the first day of February, but in 2011. So I put months, February 1st. She was given this at 7:34 p.m. And the manufacturer of that is, I'll just select anyone here, the batch number. And then she was given this where she was born in the Bahamas. Let me just say Bahamas General Hospital. And the person who vaccinated her on the card is somebody named George. And we'll save this. She was given the second dose when she was 2 months old in April. So I'll put the vaccination history. We want to say she was given the second dose on the second day of April of the same 2011. I'll put today's dates. I'm entering the record today. And then I will fill in the dates she was vaccinated. So the type of vaccine is Hep B. She was given the second dose, and she was given that dose on the second day of April. Second day of April in 2011. And she was given this in the morning at 9:30 a.m. And she was given a different dose manufactured by a different company, and then she was given in the same hospital. And the person is the same. Okay, and so let's say she was given a third dose at 18 months. Yes, so Alicia, I can see your question in the chat. So in the case where the client is an adult, you want to look at the vaccination record and fill it in so that if the client is covered in vaccines like Hep B and the rest, you don't want to vaccinate again. But if there's a vaccination you want to give people who are at higher risks and they already have it, you are going to fill it in. And so at the care clinic, they will see that this vaccine has been given, and the adults will not need to take them again. But then again, for the legal implications, you always collect, the system allows you to collect as much information as possible, but you collect what is allowed to collect it. So now we have filled in the first and second dose of her Hep B vaccine. She took the third dose when she was 18 months old. So we will put that here. And we'll say Hep B. And this is the third dose. She was 18 months old in, let's say August. That should be August, right? Let me say August. On the 3rd day of August, 2012. And she took this at 11:03 a.m. The manufacturer is the same with the first, the batch number, and she took this in the same hospital. And now the person has changed. Okay. So now we only have record for the Hep B. So you enter all of the vaccines that she was given from her vaccination card. And so this way, you know what she's missing, what you need to give going forward. And at this point, at the health center, you are done with Grace. You ignore the pregnancy history. She has never been pregnant, so we don't have that. Or the registration of pregnancy, only in the event where she's pregnant and you want to register the pregnancy. And when you have a registered pregnancy, you can record every antenatal session, which will show here up on this form if there's a pregnancy recorded. Now, because Grace has HIV, Grace has TB, Grace has syphilis, you will go to the referrals. So the pages drop-down menu, but this time you click on referrals. On the referrals, you have refer new HIV case for care registration and management. You have refer new TB case for treatment and management, and refer other STIs for treatment and management. Now, you use refer new HIV case for care registration and management if the client has HIV. It doesn't matter if they have TB or syphilis. On this system, HIV takes priority. So once you refer for HIV, other referrals are automatic because the client is HIV positive. If the client has no HIV and has TB, you want to refer for TB, so you don't refer for HIV treatment. If the client does not have HIV and doesn't have TB, but has other STIs, or you want to refer the client to be placed on pre or post-exposure prophylaxis, you refer other STIs for treatment and management. So you use referral of STI for clients who are at high risk and needs to be on pre-exposure or post-exposure, but do not have any STIs. You use refer other STIs for treatment and management. So now we are using refer new HIV case for care registration and management. Once you have a positive client, you must do the referral for the infectious disease clinic or for the STI clinic to see on their page that there is a new referral. And whenever the person comes in, they already have the person's file waiting to be registered into care. So we are going to put in the date of referral, and the date is today. And the unique ID of Grace is A11032. And she is 11 years old. Is that adolescent or pediatric in the country? Anybody? So what's the definition for 11? Anybody on the call?
Pediatrics.
I think it's a pediatric, yes.
Okay, so refer her as a pediatric client. And the reason why you have to choose this decides the type of the clinical care forms that are generated. The adult forms are different from pediatric forms. The drug dosing are different. So once the clinical management team gets onto the page, the forms displayed for pediatric is totally different from that of an exposed infant, from that of an adult, or that of a pregnant person. So we are going to click on refer. And now your job is done. You have screened, you have referred, and you tell them where to go to next for care and management. If in the country you follow up with a call, calling the infectious disease clinic to expect a client or to give an appointment to a client, you can call them. If along the line, infectious disease clinic sees that there is a referral and they have not found the person, you who did the referral will have your name stamped against the referral. And so they will call you to track the patient to make sure that the patient is registered or comes in for care registration and management. So we are going to look at care registration and management next week, but we are going to stop here when it comes to screenings and referrals. Any question? Is it very clear?
Yes.
Okay. So should we do another case, or we should head on to breakout rooms and try hands-on?
Because some of us are new, this is our first time. We were not here yesterday. I just think you should do another case.
Okay. So let me do another case.
Yes.
We'll look at case one. Case one is about Jeff. Jeff is 40 years old. He is married to a female and he has 2 children. He has a male sexual partner for casual sex. His address is given. He said he has between 5 to 9 sexual partners, but he doesn't know the exact figure. He said he is heterosexual, but romantically attracted to more than one gender. He uses alcohol occasionally and he smokes tobacco. He said he is always anxious and he uses tobacco to help his anxiety. He came in because he recently had an anal unprotected sexual encounter and he has lesions at the palm of his hand. So he came in, he was referred to come in for testing. He said he shared needles while he was injecting drugs with his new sexual partner. He also gave us a history that 4 months ago he had was diagnosed with gonorrhea. He gave us his allergy history that he's allergic to cephalosporins, and he also had a transfusion of platelets during his high school days. So we are going to follow this story and we are going to screen Jeff. The story tells us that his results is going to have an RPR result of the titer value, but a non-reactive TPHA, which becomes confusing, which means that we are going to enter the story so that we are going to repeat the syphilis test and see how we are going to enter records when we are repeating the test to clarify anything. So when you want to enter information for a new client that has no record on the system, you come to create new client account, and then it gives you the form to create the account. Now, if this person is a client who has been screened in any health center or hospital or private lab in the country and already has an account on the system, regardless of where it was created, all you need is the unique ID to retrieve the file. You don't need to create a new account. In the situation where this person is an existing client that is returning, you are going to skip the create new clients account. You will go straight to request release of client file. Enter the unique ID the client gives you, retrieve the file, and then collect information. The create new clients account is a one-time thing for every client. Once you create the account, you don't need to create a second account. If you misplace the ID, if the clients misplace their IDs and there is no way the healthcare provider will have the IDs in their head, and there is no way on the system where we allow you to save those IDs, except you want to copy them down. But the clients have control of the IDs and who they give it to access their records on the system. And when you enter the ID and you don't find the file and the client is sure that the record has been entered on the system or they have an account, then you might want to call the supervisor and see how the account can be retrieved. Creating a duplicate account should be the very last thing you do in an event where there is no way to retrieve the past record. So we are going to create a new account. Any questions?
Mildred, before you go forward, I just want to make sure I get it clear. Yeah. I am at the ID clinic and there are other health centers or other testing sites, right? Yeah. So a testing site, a test was done elsewhere. The person got a unique ID there. That person was referred now to ID clinic. So you are saying I am to use that same unique ID?
Yes.
Okay. Just want to make sure.
Okay. So we are going to create account for Jeff. Today's date is 1st day of February 2022. Now you will leave the contact of reporter as your contact for your supervisor to reach you when there is a data entry error. And so we're going to look at how the supervisors look through screenings at different sites. So the supervisors will have the permission to see all of the screenings and all of the data entered in different sites and who entered them. And so if there's an error in recording, if there is a missing record, supervisor can call and make sure that the person who entered the record corrects them or clarifies why the record is in a certain way that it should not be. So Jeff has come to the health center. So this is a testing and counseling site. And first name is Jeff. We'll assume a last name that Jeff's last name is Solomon, or we have a Jeff Solomon. So I'll say Jeff Kingsley. Okay. And Jeff is 40 years old. It means that he was born in 1982. And so we are going to put 1982. here. The biological sex of Jeff is male. His mother maiden name he gave us is, let's say, Leonard. And his testing code is generated automatically. We are not using the testing code as the unique ID, but it's always on the system as backup to verify a retrieval of a unique ID when the ID is missing. So 2102. So this will be the unique ID that I will use for Jeff. So every time I need access to his records, I need this unique ID. I will say this is a hospital registration number. Let me copy the ID before I create the account. Now we have Jeff's account created. You always need to request access to the files that were generated or that was generated for Jeff. We enter Jeff's unique ID. We select the type of screenings he is going to do. We are going to screen him for HIV. We are not screening for TB, but we'll screen for other STIs. So TB screening will be no. So now we have access to the files, and we just have to get the files by clicking collect information. Enter the unique ID, you collect information. So we have Jeff's file. It's the same thing as Grace's file, except that because he is male, his forms ends at vaccination history. There's nothing that has to do with pregnancy on his form. In the situation where somebody's gender identity changes, he is now female and he has the ability to have children, you have to switch the sex of the clients to get every female generated form. So even if the biological sex is intersex, let's say the sex assigned at birth, the person is intersex, the sex assigned at birth is male, but after further tests realize that maybe his dominant sex organs or hormones are female, and so along the line you have to change to female, and then the person has the ability to have children. So because the biological sex or the sex assigned at birth was male, the form is going to see the person as a male. So you have to change the sex now to female for you to be able to get everything that are specific to female on the trans file. So we are going to fill Jeff's personal information. Again, make sure that you collect information according to what your country allows. If you are not sure, ask your supervisor. The system allows you to use the system even if regulation changes. So it gives you all the fields, but it does not tell you that you must fill in information that your country does not allow or regulation does not allow you to collect. If you are not supposed to collect names, put in the first letter of the first name or put in unknown to the names. If you are not supposed to collect personal information, fill in unknown on most of the information. The information that are not does not have a legal implication that you need to collect are gender identities, number of sexual partners, sexual orientation, everything that has to do with addresses, phone number, is something that it's subject to whatever is allowed in your country. So don't say that the system tells you to collect it and you collected it. You always have to make sure that you are supposed to collect it. So the date of report is 1st day of February 2022. Now the first name and last name is on the form because we put in his name when we were creating his account. We are going to skip the type of ID. The person doesn't want his identity apart from what he has given so far, so we are going to leave that. He said he was born in Antigua and he lives in, let's say he lives in Grenada now. So we use all the islands. His address in Grenada, let's say he lives at and the town is, what town is this? We'll put in any town. And the health district is, this would be under Grand Bay Health District. It's not here, so put in any health district here. Then Joseph. Okay, Grand Bay is here. Not Grand Bay, this is under, what's the name of the place? So we'll just use Granby, and we'll assume that there's a Granby Health Center in Grenada. So we are going to put in the parish, which is going to be St. George. We will put in the length of time in country of screenings. He is in Grenada for 20 years. His sexual orientation, he said, is male. His gender identity is male, and he said he's heterosexual. Now, you see that his risk behaviors does not indicate heterosexual, but that is what he said he is. So put in what he has said he is. And then his risk behavior that will fill out is going to flag his behaviors without putting him under a label that he has not identified it. Okay, so now because he said he's heterosexual, we want to see what he identifies as, but we are going to fill in the risk behaviors that will tell the system the number of males that have sex with males, the number of males that use injection drugs, without giving them a label that they do not identify with. So we are going to have the marital status. The story said he is married. The story doesn't give us an ethnicity, but we are going to assume he is Black, and his occupation is he's employed. Highest level of education he has, he said he went to college, and that is where he stopped. He graduated from college. His number of sexual partners, we know about his wife, we know about the regular male partner he has, the new one he met, we know about 3 of them, and then he has said he has more sexual partners, and the story tells us he has 5 to 9, so we'll put 5 to 9. He said he has had anal sex from the story, he has had vaginal sex, no information about oral sex, so we'll leave it at vaginal and anal sex. He's not a female. Yeah, he's not a female, so this question of if he's currently pregnant is not applicable. Has his regular sexual partner been tested for HIV? Has his regular sexual partner been tested for HIV? He doesn't know. He's alive, and the cause of death is not applicable. He has left the country and he has resided elsewhere. And so we feel this, we say, okay. So now I'll tell you this kind of error message, and it's very good we see this here. When you have special characters, so when you have special characters in your entry, in the address, I used this. The system is going to reject that input because special characters are a way of security attacks. And because we are dealing with patient records, right? Or people's information, and you want things to be as secure as possible, the system throws out anything that looks a little bit like a threat to attack the database. And so it shows out this address that I put in that looks like a pattern of the scripts that is going to use to attack the system. And so it means that I will have to fill the form again. So I left that cryptic message for you to see. But on your live system, what you will see is system failure. That's going to be the message you see. So when you see system failure, just know that something you filled in has a special character, and the system has rejected one of your inputs. Maybe it's too long, and then you have to go back to fill that information again because of that. So I'm telling you now so that you don't put in special characters when you are filling in this form, because the system will show it out. So the country of birth again is, he was born in Antigua, he lives in Grenada. And then the address now, if I put that address back, but this time there should be no apostrophe in that address, even if he makes the spelling wrong, but you have to eliminate that. And so this is in, let's say this address is in St. George, or let's say it's in somewhere around Granada, yes. And then the health district is in, let's say St. George's, since we don't have that option here, or St. George. The parish is in St. George. So I'm filling in what is not correct, but in the country, you know the correct one. So we've done this before, gender identity, we've done the sexual orientation, we have done the marital status, as married, his ethnicity we said was Black, His occupation, we said, is employed. His highest level of education, college. He has 5 to 9 sexual partners. He has had vaginal and anal sex. He is not a female. His sexual partner's test status, he doesn't know. He is alive. His cause of death is not applicable. And then he has left the country before. So we save. And this time it is successful because we eliminated the special character. So now you can see the effect of improper input. Yes, so in the case of system failure, it means that one of your inputs is, I might just put a text here that tells you to avoid the use of special characters because the system will throw it out and it will tell you system failure. And so you have to fill it all over again. So once you fill in the personal information, you can see that his basic summary is updated to have his age, his sexual orientation, his biological sex, his gender identity, the number of sexual partners he has, and if the sexual partners have been tested. Because we have not filled in the risk behavior, we do not have any events or behavioral summary for him. You have 3 buttons to start a risk reduction plan, to look at the last 3 recorded risk history. So if it's somebody that comes in every year and you assess his risks every year if he's on a risk reduction plan, or every 3 months if he's on prophylaxis, and you're assessing his risks if it is getting worse, if it's getting better, and you want to just go through the last 3 recorded history of his risk behaviors, you can click on this. If you have started a risk reduction plan, you filled out the form, you want to look at the risk reduction history that you've had in case if you want to change or want to adjust, you have the button that takes you to the history. We are going to look at this in the coming weeks, not today. So the risk behaviors, we are going to collect all the information. This form is very compulsory. Although the questions are very intrusive, as the VCT provider, you know how to ask these questions without reading it out to the client or to make them comfortable to answer as much as possible. For people who don't want to answer or do not feel comfortable, fill in unknown for the questions they don't want to answer. So he puts it, the dates, 1st of February 2022. In his story, he has had sex with males. So you see, we put his sexual orientation as heterosexual, like he said. But now we have an opportunity to put in his behaviors. Even though he said he's heterosexual, he has sex with both males and females. And so the system is going to put him under what he identifies as, but also flag his risk behavior to increase the number of males that have sex with males. So they had sex with persons of known HIV positive status. You want to put, let's say he said never had sex with sex workers. We'll say he said he has done that, but over 12 months ago. He has exchanged sex for drugs or material gain. Let's say he said he has had sex with sex workers, so he exchanged sex for, so he's not the one gaining, the lady is gaining, so he will say never. Shared needles while injecting non-prescription drugs in the last 12 months, crack cocaine. So if he had injected non-prescription drugs or he shared needles, it's most likely that the drug was an illicit drug, right? And so we will put this as in the last 12 months also. But you want to ask what kind of drugs if you want to know if he's using any illicit drug. Had sex under the influence of drugs or alcohol, he will say he has done that, but not in the recent year, over 12 months ago. Had sex with multiple partners in the last 12 months, had perinatal exposure to HIV, you say no. Receive a transfusion of blood or blood products or clotting factors, you will say never. Had occupational exposure, he is an engineer, so he is not exposed, so say never. Been a victim of sexual assault, he will say never. Received a transplant of tissue or organ or artificial insemination, he says never. Confirmed diagnosis of STI at the time of HIV testing. So we'll assume that this is yes. We'll say he said he had gonorrhea, he's under treatment, or he was treated, but he has symptoms of other things. So he has had a confirmed diagnosis of STI. This question is subject to what you want to fill in, either yes or no. Is he still, have you tested or have you confirmed that he was really treated for the gonorrhea? Is it okay? Is he okay now? Does he has symptoms? Obviously, he came in with symptoms, and that is why he is at the clinic. So You decide what you want to fill in here, yes or no. Confirmed diagnosis of TB at the time of HIV testing, no. Contact with confirmed TB, no. Being previously diagnosed with HIV, this is for TB patients, and this question is not applicable. His condom use, he tells us that he uses condoms occasionally. We have different options for condom use. If the person said they always use condom, that means they've never had sex in the last 12 months without use of a condom. If they say they usually use condom, which means that in very rare occasions will they have unprotected sex. If they say sometimes, it means that it just depends on their mood, right? And occasionally means that maybe they do not use condom with their regular sexual partners, but they always use condom with a new sexual partner. So occasionally. Rarely means that they hardly ever use a condom except somebody else insists on that condom. So they always hardly ever want to use it. And never means that they have never used a condom or they don't even know what it looks like. And so you're going to fill in the information and when you ask them for clarity on how often do they use condoms if they use it. And so let's say he said he uses condoms sometimes. And he said he was arrested once, over 12 months ago. And he said he was homeless once after he was released over 12 months ago. He's not a sex worker, and he said he has never been a sex worker. And he said he has had sex with transgender female, and he knew it was intentional. And so we'll say about over 12 months ago. So we are going to save this. So we have collected his risk behaviors. And because we have collected that, you will see that his behavioral or event summary have been updated. But this time, you can see clearly how some texts are in red and some texts are in black. Because he has had sex with sex workers over 12 months ago, it's in black. The system is not flagging it as a very high risk to be in red for decision, but it leaves it there as a risk for you to assess. But the ones in red are the ones that you need to take action on immediately. But everything that is flagged is important. It's just that some are red because of high priority. Everything in the last 12 months is red. Everything over 12 months ago that is doesn't have a time. The time does not reduce the risk it poses. It's going to be in red. And everything that the time over time it's no longer important. It's in black. So you have the event summary to decide your risk reduction plan or the next course of action or the type of test you want to do. Because he has all these high risks of injection drugs and multiple sexual partners, having sex with males and females, you want to also see if you are in the hospital or in a facility where you screen for Hep B, HCLV, and every other thing. You might want to do all the tests that you normally do for injection drug users. So we go to HIV screenings. You can fill in the comorbidity information if you have the time, but since this is not the most important form, we can leave it blank and we skip to the HIV screenings form. On the HIV screenings, you want to put in the date of report, first day of February 2022. The test modality is we are screening rapid test. The type of test is HIV rapid test. We are screening with determine. And the results for this will say it's non-reactive and the date is today. Sorry. Now we have put in the rapid test is non-reactive, so we don't need to do any further HIV test. We just move into the syphilis screening. So the syphilis result is the one with the conflict in the story. And so we're going to put in the date, 1st day of February 2022. We did a VDRL test. He has a titer of 1 in 64. We say this is reactive and we get the result. And then again, this same test is telling us that the TPPA done is non-reactive. For the doctors on the call, is it a possible situation for you to have this titer value and have a non-reactive TPP in the event where it is not a false positive or false negative?
No.
Okay, so that is where the conflict starts. So because we are going to see this TPPA result that is non-reactive, and then we cannot believe this result because the titer value and the TPPA are not telling the same story. So we will put in this test result that we have, but we request that this test is repeated. So this is the situation that this story creates, where we see how we are going to repeat a test and we're going to record the repeat. So now let's say Jeff has left the clinic. We have given him a form to go and get these two tests repeated. He will do a VDRL and TPHA again and return with the results. And Jeff decides to return. 4 months later, he didn't come back the next week. So 4 months later, he went in for the test and he's back. Today, 4 months from now, so let's go forward in time. Today is June 1st, June 2022. So we now have a time travel and he's coming in. This time, his titer value is 128. Or let's double it, let's make it worse. Or let's just say it's the same. And this is reactive. And we know it might not be the same in real life. And so we are going to put this and we're going to save. Now, the VDRL this time, or the TPHA this time, we'll put it in June, is now reactive. And so now we have the diagnosis for syphilis. He now has lesions on the palm of his hands. He is positive for syphilis. We do other screenings for Hep B, according to the story, HCLV, and all of them are negative. So for you to do other screenings, you want to record other screenings, you go to the other screenings tab. You put in the dates. So we are still in June. We'll come back to reality soon. And the type of test we are going to do here now is the Hep B. Well, let's do HCLV first. And this is negative. So he's free. So we're assuming that this is in the SCI clinic, and so all these tests can be done. And then we are going to record for his Hep B also. So now, I don't know what the standard is, but he has his Hep B negative, right? So maybe he did a surface antigen and it is negative or non-reactive. And you want to offer him vaccination against hepatitis B because of his risk behaviors, right? In this situation, you collect his vaccination card. You will record his vaccination history to be sure he has not had the vaccine or for Hep B. But again, you might want to do, apart from the surface antigen, you want to do the surface antibody or the core antibody and see if he has natural immunity, if he was infected before and treated, if he has been covered, or you just want to go straight to vaccination. So it depends on how you do it in the country. For Hep B, you want to check if the client is covered before vaccinating, or you just want to vaccinate when the test is negative. That is your decision. So you fill in the vaccination history. If you are giving the vaccine for the first time, you put in the day and then put in the dose and the dates you are giving the vaccine. So this form will collect the history and can record new vaccination. So once you are giving a new vaccine, you record it here. Once you are done, because he doesn't have HIV, but he has syphilis and he has history of other STIs in the past, you are going to go back to pages and you go back to referrals, but this time you refer other STIs for treatment and management. You fill in this form, the STI clinic is going to get the referral and know that this client is not coming in for HIV management, but all of the files and the screening history will be transferred as soon as you do this referral, and we are going to look at that next week when we look at peer registration and initial evaluation of all the clients that are referred to the IDC or SI clinic. And this is all for today. Questions, clarifications before we move into breakout rooms? Okay, so I say it's clear for now. Is there anybody who doesn't have an account on the patient management and reporting system? We can create them now so that we'll go into breakout rooms, and then you'll be able to get in with the hands-on session. Anybody? So you can give me your name. I'll start creating your account. Okay, Alicia, you do not have one. So let me create that. So let me create your account. First name, right? What's the last name?
Emmanuel, 1M.
Okay. And the email?
Alicia.James.
Like this?
Yes, John.
That's John?
@gmail.com. JOHN for the confirmed email.
And then you are screenings and management, general population, referrals, updates, and prevention control. Okay, so you will get an activation email. You agree to the confidentiality agreement, and then you will set your password.
Okay, thank you. Let me do that now.
Any other person who needs an account? Okay, so let me create other accounts here. So you can ask your questions while I create the account. And screenings and management, I'm going to give you all permissions, and I will click on create. So Lana, you can go into your email and activate your account. So for Juliet, what is your email address? If you put your name in the chat, please give me your email address.
Juliet Blaze at Hotmail.
Okay.
At gmail.com. Juliet Blaze at gmail.com.
So you activate your account, and I will attach it to your testing site shortly. Let me create all the accounts for everybody. Okay, so look into your spam or your inbox and get your activation email, and then activate your account. Then, okay, so once you activate this account, you have to now log into patient management and reporting system. Who else? Whose account have I not created? Anybody? So check your
Trisha.
Trisha.
Miller.
Okay. Correct. U. Needs to be a U instead of an O, right?
NURMELA.
Okay. So what is
and
the email?
You as an umbrella.
Yes, I will correct that, but I will have to fill in the email first.
T R T as in tree. E S H A K B L A I Z E at Hotmail.
Lyntia, you said you didn't receive an activation email. What is your email address again? But you received it because your account is activated. So you will have to, it's showing you activated your account. So you'll have to go to log into Patient Management and Reporting System and use the password that is set when you activated your account. So now I'm going to attach. Okay, so who else? Ingrid, you have not received your own? Let me check. Yes, your account is activated also, and you have it. So you have to log into Patient Management and Reporting System. So I am going to attach everybody to testing and management site. So it might not be your correct site. I'll put you anywhere. But in reality, they'll put you in the list of sites you have for your country. So without being attached to a site, once you try to create an account, it will tell you to contact your admin to place you in a testing and management site before you can record, because all the records are going to be tagged against the site that you were assigned when you filled out the form. So if you are testing from a different site that is not your site, make sure that, or you are assigned to a different site, make sure that your supervisor updates the site that you are assigned to, so that your screenings are not recorded in the previous site where you. So now I will randomly group you into the breakout rooms where you will do between case 1 and case 3. You can twist the story to put in your to do, but you discuss and fill it in hands-on as many times as possible. Somebody will share and present while the others will be putting it in. So you are free to make as much mistakes as possible, start over, and then that way you will understand. So case 1, case 3 is what we are working with. So the case scenario is on your page. So if you log into training, you'll find it to download if you did not get it in the email or last Friday. Anybody with a case scenario can read out the stories to the participants, to the other people in your group while you enter the record. So I will be jumping in from one breakout room to another. If you need my attention in your breakout room, just call and I'll be there. So I'm going to stop sharing.
Mildred, before you go, remember, you hearing me?
Yes, I can hear you.
Remember when I messaged you, it's not that I'm not having any issues logging into the case-based surveillance system, but it's just that the training account like that we are now, I am not getting in because I am using Jonelle's account right now. So I didn't get the email that you sent. This email that you told me you sent, I didn't receive it. I checked my spam and I didn't get it.
Okay, which one? Is it for the training or
for the training? Yes, for the training account.
Okay, so after this session, I can create the training account for you.
Okay.
So you have access to the patient management system, right?
Yes, I do.
Okay, so once the session is over, you have my number. You can call and then we'll walk through creating.
Okay, no problem.
Okay. Then I will put you in breakout rooms now. So I'll put you in room of 5 in one room. I think that should be okay. So you have rooms with 5 participants automatically created, and I will open all rooms. So welcome back. We are going to take questions, suggestions, difficulties. So we're going to take questions, suggestions, difficulties before we close for the day. So anybody?
Yes, I have a question.
Okay.
Well, part of our challenges, as we told you earlier on, was the fact that when we started the information, it was being on one person was doing it collectively, and the person got bumped off internet issues. So we already observed without the ID, we could not get into it because we tried. But one of the things that we observed is that we tried to get back into the same client that we had created the account for, and I think we were along the same line as to what the ID was, but what we observed is that when we enter the ID, the system asks for the site of registration.
Okay, so it means that the person who logged in had no site assigned to the account. So once you have that site of registration notification, the first thing you do is to call your supervisor to tell them that you are not assigned to your testing site.
Okay, so the reason why I'm curious on that aspect, for example, this person was, okay, so we're putting in this information for this young lady from the accident emergency department. Yeah. This is where would have been her site, the initial area. But now this young lady is calling, let's say, going back to Grand Bay, which is her area of residence. The site will be different. So at Grand Bay, we are trying to access her information, putting up her login ID, but then getting the request for the site. Peradventure, you do not know where this young lady was initially registered. How do you go from there?
No. The system does not ask you for the site as long as it's within the country.
Oh, right? Okay.
So any site, the system only logs the sites where you access a record, the site in the country, and the site where you record an event. So even if our account was created in Grand Bay, for instance, and now she's in Roseau, it's going to tell you that yes, the account was created in Grand Bay. She goes to the health center, but today she's at Roseau, and everything you record today is going to be tagged to your site.
Okay,
although her health center will see all the records and see where she went to. Okay, because it was when we put in the ID, it didn't go any further than ask us for the site. Yes, so if I was curious. No. If it doesn't go further, ask me for the site. It's asking you for your own site, not for the child site. So it means that your account was created, but you were not attached to a site. Because what the system does is that any activity you do on a client's file, it's going to be your name and your site. And the system wants to know the sites that you are screening from. Okay. Yep. All right, clear. That was my challenge. Okay. So any other person?
Mildred, I do not have any question today. I think because I was here yesterday. Today, makes this presentation even more clearer. So thank you so kindly.
Okay, you're welcome. Any other person?
I just want to say something though. I think for those of us who are on, the first session is usually better than the second session. So if you log on the first day, you know, you take your time, you go through, but the second day sometime because you went through it already, it's like a little rush. So first day.
Okay. So yes, now that you've mentioned that, tomorrow we are looking at screenings, but for pregnant clients, and we're going to repeat it the day after. No, we're going to repeat it on Monday, not on Thursday. So we'll do it on Wednesday, and we'll repeat the same session on Monday. Because of how complicated the pregnancy and the whole antenatal is, it's advisable that if you have the time, you want to attend tomorrow, you want to attend on Monday. Everybody here, it's important because if you have somebody walking to the health center and she's pregnant, if she has not registered her pregnancy, you might just want to do that since you already have access to the form and record her screenings under her pregnancy and not the general screenings, so that the reporting can tag when, at what gestation age she was screened for HIV and syphilis and hepatitis towards the EMTCT reporting. So I saw a hand raised.
Thank you, Mildred. When we were doing the case management, looking at the services that we offer, when we came to the one with the MAN2 test for the TB screening, yeah. I wasn't sure if it was referring to the fact that TB screening is being done on the site or the client is being referred for TB screening. That wasn't clear to me. I don't know if it was clear to any of my colleagues as well. Why I ask, because I know in Antigua we do the MAN2 test, but not on site. We usually refer. So how is that situation dealt with? Please, thank you.
Okay, so if you refer them for a MAN2 test and they are going to come back to you, you want to record that you refer them, and then your test results will be awaiting results. I know the MAN2 test, it takes 3 days to get the results, right? And to read the results, right?
72 hours.
Okay, so 72 hours, and then if they are coming back to you or they go back to where the test was done, if it was a referral, you have awaiting result there on the system. So whenever they come in the future, you might want to follow up on what it was the last time. And if the site they were referred to uses the system also, then the site will enter the reading of the induration.
Okay, thank you.
I have a question.
Yeah.
The code number.
Yeah.
I didn't get that one. I just see the number, but I didn't get how you.
Okay, the testing code?
Yes, the code.
So the system generates the testing code based on the algorithm that is used in the country. First letter of first name, first letter of last name, first letter of mother's maiden name, the last 2 digits of the year of birth, and the gender, F for male, and for female, M for male, I for intersex, and U for unknown.
Okay, thank you.
Yep.
Question.
Okay.
So in this regard, if there are 2 persons, well, twins, who would have the same detail, how would it differentiate between one person and the other?
Yes, that is why we use a unique ID, because the testing codes are not unique. So if the testing code is generated, you can have 100 people in a country having exactly the same testing code. And you can't use that for the system because the system will accept the first one, but the second one is to tell you it's already in use. And so that is the purpose of the unique ID.
Okay, thank you.
Yeah.
One more question now.
Okay.
When you're now filling out the patient information, okay, you said that the important information shows up in red. Okay,
Yes.
talking about the risk factor and so on. But I noticed below that there is also a risk reduction plan. Do you have a form, or the tester, whoever, have to come up with a plan?
Okay, so there's a form, there's a risk reduction form, and we're going to look at it when we look at the partner notification service, right? The risk reduction form holds the information where you fill in, maybe if you give condoms, number of condoms, pamphlets, if you talk about sexual partner screening or reducing number of sexual partners, everything about the sessions. And then if you are putting the clients or referring the clients for pre or post exposure prophylaxis, it's going to go on that form also. And if the client comes back in the future, maybe the client takes a lot of alcohol. Every session you have for risk reduction, everything you give out to the clients to help with risk reduction. We'll look at the form critically, and you see all the fields you fill in during a risk reduction session.
Thank you.
Okay. And any more questions? So we are planning to have a repeat of this session for those who are in another training sometime towards the end of the week or next week. I will add it to everyone's schedule when we come up with a date with the others. And if you feel like you still want to understand it deeper, you will be able to join, because I will give everybody access to the session and you join if you want to join it.
Yeah, that would be great.
All right, so if we do not have any more questions or suggestions, we'll see tomorrow, and we are going to look at case number 2, who is, no, we're not looking at 2, we're looking at case number 5. We're looking at the pregnant teenager. Did somebody raise hand?
Yeah, Juliet.
Okay. Okay, go on.
No, I think her hand was up from her previous comment. She didn't put on her hand.
Okay. So tomorrow we are going to look at case 5, 6, and 7. So if you are part of tomorrow's training, you can go through the case if you have the time today, and we will see tomorrow at 9 a.m.
A quick question before you leave.
Okay.
I think when I came in, you said you were starting on page number 3 or slide number 3, and you had to go back to the beginning. You did?
Yeah, no, I started from case 3, yes, and I did case 1.
Okay.
I did 3 and 1. So I will send you the recordings. I will send a link to the recording so that you can review if you want to.
Okay, thank you.
Or you will check your resources later tonight or early tomorrow, depending on when I get the recording, and you will see a link to view the recording.
Okay, that would be great. Thank you.
Okay. Any more questions?
Clarification. So there's no session in the afternoon?
No, no session in the afternoon. So we were supposed to have yesterday 1 session in the morning, 1 in the afternoon, and today 1 morning, 1 afternoon. But everybody yesterday wanted to finish up yesterday, and everybody today finish up today. Have a very good afternoon, and we will see you tomorrow.
Thank you, and same to
Okay,
you.
see you tomorrow. Bye.
Thank you.
All right, bye.
Bye, everyone.
Thank you. Have a good one.
All right, bye.